Entonces vamos a cambiar primer pilar fundamental.
Colombia's President Gustavo Petro proposed several controversial health reforms in February. The government says they will improve primary care, expand access to it, and raise healthcare workers' salaries and fight corruption. Colombia's mixed public-private healthcare system has prided itself in its high coverage rate. 96% of Colombians have some sort of medical coverage, be it subsidized, public, or private. But some healthcare experts say the biggest flaw is the quality of service for patients.
There are problems with that coverage in dispersed regions, faraway places, but also in cities with a lack of specialists. Colombia has a deficit in medical personnel, nurses, and specialists, so receiving medical attention takes time.
Rampant corruption is also a problem, but some believe the proposed solution to eliminate private sector healthcare providers will only result in more corruption. After presenting his healthcare reforms, some of them considered radical, Petro's government spent the next month trying to repair his splintered coalition in Congress.
There was an attempt to propose a system that is completely public, and that goes against 30 years of experience, and that would go against advancing. So it is best what is now being proposed, which is maintaining advancements and adjusting what is wrong.
The government tried to rally Colombians behind the bill with marches in favor of the government's reforms. Many Colombians argue changes are needed. Getting a timely appointment with a doctor is difficult, so medical attention is often sought from emergency services, which only bogs down the health system. The bill proposes the creation of primary care centers to accelerate access to medical care. But one healthcare expert says the reforms could have all been done without proposing a new law and avoid the political infighting.
It can all be done with political will in a more effective and less complicated way, in how the money is handled, paying our professionals better, and more regulatory mechanisms. It can all be done with regulations and without so many issues.
Gustavo Petro's ambitious reform agenda has lost momentum. The clashes over the healthcare bill threaten Petro's fragile political coalitions and his chances of also passing pension and labor reforms during his first year in office. Michelle Vega, CGTN, Bogotá.